too long, we've looked at the solutions to problems that people may have as being solely coming from the health service, when we now know that there are many more assets that we can all rely on.
Social prescribing services are best organised on a partnership basis across a whole local area.
I think partnership working is the key ingredient to social prescribing.
It's about creating connections, it's about harnessing the assets within communities, and most of all, it's about providing a much more holistic support service.
For social prescribing to work successfully, you need to have a strong partnership with primary care, with the local authorities, the voluntary and community sector, but most importantly with the residents and the patients.
We're all here to serve our community, and that's what we're able to do because of our working partnerships together.
We often forget primary care is part of community. It's often perceived as them and us, and actually, no, it should be sort of all joined up together.
We've basically taken the time to go around all the different communities, make ourselves known, speak to them. Just by having that kind of relationship with lots of different services means that we can bring that to the GPs.
Social prescribing fills that gap between primary care and the community. It's the link.
Part of social prescribing is not trying to direct people back towards the GP surgery, is directing people back out into their communities where the resources already are.
We're linking with the community groups and the voluntary organisations by networking furiously to benefits advisors, to employment agencies, all those kinds of things that perhaps a GP wouldn't have that knowledge.
You need to be constantly connecting with services, introducing yourself, telling services about what you can do and finding out what service they provide.
The other thing that social prescribing does is unlock the assets within communities, and the very people who get socially prescribed end up becoming part of the assets of that community and contributing to those groups and activities themselves as well.
We have made tremendous progress in rolling out social prescribing, employing social prescribing link workers, beginning to think about the assets within our communities, and to begin to build exciting partnerships.
I want us to break down those barriers between general practice and our communities and the voluntary sectors and the statutory services. And I would love it if through social prescribing, we were able to empower patients to get into their communities and empower their communities.
I hope that we can turn round and see social prescribing as a key part of our everyday way of dealing with healthcare.
I think we're poised to go further, faster, and with greater impact. And I'm really excited about the promises that social prescribing could hold to help us to really think differently about health and our well-being and improving population health outcomes.